Welcome to Foad and Friends blog, where we separate fact from fiction. I am Foad Nahai. I have been in practice for over 4 decades. I have written papers on all aspects of plastic surgery. I've written at least 14 books, and I'm editor of this journal, peer-reviewed journal, where we sift between fact and fiction, where we know what works, what doesn't work. And with me is Bassiri-Tehrani, and today we're going to discuss the important topic of the differences between toxins, or as some like to call them, neuromodulators, and fillers. There seems to be some confusion. They do work hand in hand to rejuvenate the face, but they're totally different. They belong to a group of treatments that we refer to as injectables because we inject them. We also divide what we do as aesthetic surgeons, plastic surgeons, into surgical and non-surgical. Surgical are things that we do in the operating room with a scalpel. Non-surgicals, a huge part of it, are the injectables. Other non-surgicals are lasers and power machines that have an effect on collagen, and some machines that have an effect on fat. So I will introduce Dr. Bassiri, who is our fellow. A fellow is someone who's completely and well trained, in his case, in plastic surgery. He's serving a fellowship to perfect his skills and knowledge of aesthetic surgery and cosmetic medicine.
Thank you. So first I'll dive into talking about toxins or neuromodulators and the key difference between toxins and fillers. Toxins are shown right here. So the most commonly known is Botox. That's the brand name. Another brand name is Xeomin, and another very popular one is Dysport. These are just brand names, but effectively they all just treat the muscles that cause the wrinkles in the first place, which is different than a filler, which does exactly what the name suggests, just fills in the creases, and so that adds volume to the areas that you're injecting. In toxins or neuromodulars case, the common areas that we inject are between the eyes, known as the glabellar area, also the forehead, that affects the frontalis muscle, and then around the eyes on the outside, also known as the crow's feet. These are the most common areas of injections for toxins. And for the fillers, you can inject anywhere that you have any areas of depression, areas that you want to add volume. Most popularly, lip injections are an area of interest these days to enhance the volume of the lips, which gives a rejuvenated look.
The injectables have had a meteoric rise over the last 20 years. They are by far the most common aesthetic procedures, and the reason for that is several. First of all, they are safe and effective, especially in trained hands. Number two, they are office procedures with minimal, if any, downtime. And number three, in the short run, they are very cost effective. The important thing is to go to an expert who's an expert with the injectables, but also has some sense of who is the best candidate for injectables and non-invasives, and who would be better served by a surgical procedure. These are topics we'll cover in later blogs, but obviously somebody who needs to have a facelift will not see the same effect from fillers. In the long run, the facelift will provide them with a better result, long-lasting, and more cost-effective. But for those individuals who don't need or are not ready to have a surgical procedure, the injectables have really changed the way we do things. I mentioned that I've been in practice for 4 decades. We didn't have these about 25 years ago. Now we have it. We have so much we can offer to our patients. I mentioned about training. It's important, whoever you choose to be your injector, that person knows the anatomy under the skin, knows the products they're injecting, the risks, complications, and heaven forbid, if they run into trouble, they know exactly what to do to prevent any untoward or adverse effects for the patient. So before we go to the fillers, Dr. Bassiri will go over some of the unwanted effects, or as we like to call them, adverse events or AEs of the various toxins.
So one of the common side effects of Botox is that it may weaken the muscle in an area that you don't want. So for example, if you weaken the muscles around the eyebrows or around the eyelids, that may cause a droopiness of your eyebrow or droopiness of your eyelid. That's also known as ptosis. That's an unwanted effect because it may give you the appearance of being more sleepy, a tired appearance, and an overall just a more aged look in the periorbital area or around your eyes. So we take special techniques and methods in consideration when injecting Botox with a full understanding of the anatomy to make sure that we're doing this not only in a safe manner, but one that doesn't result in an unfavorable outcome. And so there are certain things that we can do if you do develop that droopiness of your eyelids, one of which is an eye drop called Upneek, which actually stimulates one of the muscles inside your eyelid to kind of counteract the effects of Botox. And that's a drop that you put in once daily to help. However, nothing is going to undo the effects of Botox once it's already injected. And so you would have to wait the lasting effects of Botox, which typically is around 3 or 4 months, depending on the patient. There is a different Botox brand, or toxin brand, I should say, that I did not mention, and the name is Daxxify. Daxxify touts a 6-month effect of the Botox or the toxin effect, and so the results are not entirely out yet. We're still trialing it right now, so the jury's still out. But all the other Botox brands or toxin brands are typically around 3 to 4 months, and this new brand is claiming that it's going to be longer than the average toxin or neuromodulator.
Make sure when you have a toxin injector that it's FDA approved. I'm not aware of any life-threatening complications related to the ethical application of any of the toxins that are FDA approved. There are stories of life-threatening complications when what we call fake toxins have been administered. Most of us actually show the unopened box to the patient so the patient knows that they're getting a product that has been approved by the FDA. The same goes for the fillers. Now, if Botox relax the muscles and improve on the lines, what do fillers do? Literally, they fill. As we age, we all think that we age when our face and skin sag, but there's more to aging than that. We actually lose volume. So there are a variety of fillers that will add volume to the eyebrow, to the area around the mouth, to the lips, and these are called fillers. There are several categories of fillers. Outside of the United States, I dare say there's dozens of them. In the United States, thanks to the FDA, we only have a few variety of fillers available, and some are classified as permanent, some are classified as semi-permanent, and some are classified as reversible. The most popular are the hyaluronic acid fillers that are reversible. Several companies produce them. Basically, they are the same. It's a natural product, and it's reversible through the injection of an enzyme. Where they differ has to do with how the product is changed to make it more viscous, less viscous, so that we can go from something that is very thick and best injected deep to something that is very, very light, less viscous, smaller molecular size that can go under the skin. So it's important to choose an injector who's familiar with the variety of fillers and can recommend which one would work best for you. It's not unusual for us in our practice to inject a lighter, less viscous filler right under the skin and something that is a lot thicker, deeper, to restore the volume in the face. I'm going to turn it over to Dr. Bassiri, who will explain the term liquid facelift. That's very, very popular, and it can be misleading.
Yes, it's very popular because it obviates a surgical procedure, which is a common thing that patients want to know more about. A liquid facelift effectively is injecting liquid filler in areas of the face that have not only lost volume but also need some element of rejuvenation. It also helps build the foundation of the face. There's no excision of skin and there's no tailoring of the skin in any way. However, by building up the cheekbones, by building up areas that have deflated over time due to aging, it gives the overall appearance that the face is more youthful, even though there's no excision of any skin whatsoever. Everyone is different. Everyone loses fat in somewhat of a different distribution. However, the general principles are more or less the same. Most people lose volume in their cheeks and in certain fat pads, and other fat pads become more prominent as a result. The way that fillers are used is in different distributions to blend those areas and to blend certain subunits so that it's more smooth and it's less obvious that aging has taken place. But again, this is not the same thing as a facelift. It's not the same thing as a mini facelift. It's not even the same thing as a minimally invasive facelift or face type procedure, which involves energy devices. This is merely just injecting gel, or in this case, filler. There is another procedure called a liquid rhinoplasty, which along the same vein is injecting filler along the nose. You could be either on the bridge or the tip, and more sophisticated techniques are off to the side, although that's a little bit more dangerous. And the purpose of that is to, again, contour the nose to make it more even and to fix any contour irregularities or any bumps that you may have. This liquid rhinoplasty is popular, but it's very dangerous if not done correctly. And there have been case reports of blindness injecting around the nose and in between the eyes, because that's a highly vascular area with a lot of blood vessels that is at risk when injecting in that area. So make sure you're going to someone who knows what they're doing, has experience doing it, and also knows what to do if, God forbid, something happens and they know how to fix it.
I will just reiterate, I said earlier that the popularity of the injectables is that they're effective, safe, and affordable. Safety is important. There have been, though very rare, problems with filler injections causing blindness and loss of tissue, but fortunately these are rare, especially in experienced hands. So it's important that you ask whoever is injecting you, ask about their training, their background, and their experience with the materials they will inject. So we will conclude this session by again reiterating that these are very popular procedures. Toxins and fillers are totally different. Yes, they will complement each other, but they each do something different. The toxins relax the lines around the eyes, forehead, and even the bands in the neck. The fillers restore volume where it has been lost, and through the replacement of volume will result in some lift of the tissues, but nothing as dramatic as a facelift.
We hope you like this episode. Stay tuned for our next episode where we'll dive into other topics in plastic surgery. Please share and like this video and subscribe to our channel. Thank you.